Hello, my name is Casondra WIlliams, and I'm going to be presenting on the nursing curriculum issue of counting simulation experiences for clinical hours. Traditionally, in the United States, nursing students receive lecture education in the classroom setting and develop technical skills, enhance their critical thinking, and learn the art and practice of nursing in a clinical environment. As technology has advanced, simulation has become a more common way to educate. Two types of simulation, for the most part, are present: low fidelity and high fidelity. Low fidelity is typically used within the assessment courses and fundamentals courses just for practicing, placing stethoscopes in the correct places, starting IVs, doing basic patient care. And then a high fidelity typically has a faster, more realistic system response, and that would be for your advanced med surge, for your leadership, the more involved scenarios where you have to prioritize and figure out what tasks need to be done first. So next we're going to talk a little bit more about simulation and what some limitations and benefits are of simulation, and then we're going to talk about the National Council of State Boards of Nursing study that was done on simulation and the effectiveness of it in place of simulation of clinical hours. So some limitations of simulation: it may be stated that it's not real, there's a limited realistic human interaction, students may not take it seriously, there may not be symptoms that are observable, or they may not be complete physiological symptoms, something like that. And it's been shown in research, when students are made aware that their simulation will be counted as a clinical experience and the expectations are the same for simulation and for clinical, that they respond just as well as in a clinical setting. So next we're going to talk a little bit about benefits. There are many benefits to simulation. It really reduces training variability and increases the standardization of what is taught. It really guarantees an experience for every student. As we know, in the clinical setting, you can't guarantee that at every OB clinical there is going to be a baby that's going to be born. Those type of things. You can't guarantee that a trauma is going to come into the ER when your student is scheduled to be there, when you're scheduled to be there. So it's really great that these simulations can be set up, designed, manipulated, customized for individualized learning. They can be reproduced. They can occur on a schedule, and then they can pause and let the students think about what's going on and the situation and process, and then think out loud so that professors can help them walk through what they're thinking, so that they can help them either direct them where they should be or help them along where they're headed. Simulation is a safe place that offers opportunities to make and learn from mistakes. It's very student-centered. Another great thing about simulation is it allows independent critical thinking and decision making, as well as delegation. That doesn't happen very much in the clinical setting. A lot of times students take a dependent role to their professors due to the patient safety factor. So it's really important that we give them that opportunity to be independent critical thinkers, as they will have to be when they are nurses on the floor. And it also allows immediate feedback. So these students are getting feedback from professors, they can be getting feedback from observing students. It's really great, or they can even observe themselves if it's videotaped, and they can see their growth over time when they started up until when they get close to graduation. So it really helps them to process through what they're learning and to make sure that they are understanding all the pieces that are going into whatever simulation they've walked through. A really important piece that makes simulation hours so helpful as these students are building a foundation that they're going to work off of for the rest of their career is that debriefing portion. This is a key component of simulation, and its importance is so well documented in literature. And using simulation provides opportunities to practice clinical reasoning skills in a controlled environment. But it is extremely important that these things are discussed and walked through with an experienced faculty that can help these students really understand what you were trying to get at, what the outcomes were, to make sure they meet those so that they have met their overall outcomes for the program. Next, we're going to talk a little bit about the evidence that was in place with the National Council State Boards of Nursing. They saw simulation as a great opportunity to allow these students to really get in a good place before they start their nursing career. And so they wanted to do a study that was randomized, controlled, and a longitudinal study over a broad number of students. They chose nursing students from 5 ADN programs and 5 BSN programs, and they represented rural and metropolitan communities. The National Council State Boards of Nursing, or NCSBN, wanted to look at the effectiveness of simulation in a partial replacement of some clinical hours. And they wanted to see if those students would perform as well on exams and if they would perform as well in clinical. And so there were 3 groups that were made. There was a control group where students had traditional clinical experiences. No more than 10% of their clinical hours could be spent in simulation. In the second group, it was 25% group. Students had 25% of their original clinical hours replaced by simulation. And then finally, in the 50% group, students had 50% of their traditional clinical hours replaced by simulation. So we're going to look at a couple graphs real quick just to kind of see what the comparison was. So this first graph has the 50% group in red, the 25% group in green, and then the control group in blue. And as you can see, there's not much difference between each of these lines. So I'm going to go to the next. And this is looking at how these scores were assessed in the traditional clinical setting for fundamentals of nursing, for a fundamentals of nursing course, and then went on to these scores assessed in the clinical setting for a med surg. So those are very similar. Then we're moving on to ATI scores. And as you can see, very little difference in those. And that was for the medical surgical nursing assessment. The next one is for fundamentals of nursing assessment. And then this final one was from the ATI RN predictor scores, which predicts the likelihood that these students will be able to pass NCLEX. And so as you can see, there's really not much of a difference. So it's not statistically significant between each of these groups. So the results of that are saying that the students that had 50% of simulation performed just as well as those who had the 10% of simulation and the 90% of the clinical hours. So it's really interesting to see those results, and I'm sure we're going to continue to research and to make sure that that research is valid and different kinds of things, but it's really great to see that simulation is as effective with this group of students as clinical hours are. They won't replace clinical hours and clinical experiences. However, it is a great place and a great tool to use to build that foundation. So as you've seen, simulation that is really effective, that really involves the students in the learning process and gives them an opportunity to grow in their foundation of nursing, can really make a huge impact on their nursing career. Thanks so much for listening, and I hope you have a great evening.